Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and I wanted to talk a little bit about costs or prices for staff and staff's family and friends of family and their kids. And ultimately, this is really gonna come down to your handbook, your operating book that you have in your office. What are your policies? You should have a policy on this for how dental work works. Most of you have free preventative care and then discounts on other care, usually lab fees. And that's fine with little 1 day procedures, especially if you're filling, holes in your schedule. I don't think that's an issue. But this is a bigger procedure with a huge commitment that has a massive lab fee depending on what lab you're using. So I'll kind of tell you on what we do. And do I have anything formally written down? No, because I think a lot of it depends on the particular situation. But for us, for full-time employees who have been with the company X amount of years, and I'd have to ask my husband what the X is. It's definitely not one. You've got to be there for a little while. Full-time employees, it is lab fee. That is the cost of the ortho treatment, and they have to pay the lab fee up front. So, that way we're not on the red for owing the lab fee and trying to get it back. They have to pay it up front before we submit the case. So that's a $1,900 lab fee or so that they have to pay to start the case. And then any other lab fees that might come up, be it lost retainers, lost aligners, retainers later. As long as and the caveat is as long as the employee is still employed with the company. And then the other caveat is if they quit or if they are fired, they cannot just take their case someplace else. Now, have people done this? I'm sure they have picked it up and left, but the case has to be transferred from one provider to the other. So we will transfer the case to whatever provider they choose is how we tell them. So, they have to let us know. That way, we don't want people, especially if it's a negative situation, coming back to the office and poisoning things, anything like that. It's negative for you. It's awkward. It's negative for the office. So that's pretty much our position on that. We'll transfer it to a different. So it's your job, and that's possible. You may have to pay someone else to finish the case. Is what it comes down to. So, the benefit is they can get started just for the lab fee, and they're gonna probably only want to get started if they're planning to stay, is what it comes down to. So it's a win-win for retention, I think, for the office, and it's fair. Now, sometimes with Invisalign, and you'd have to check with them, if you do X amount of cases, they will do a case at a reduced to low lab fee, and don't think for staff, and they have to authorize a staff. So you'd have to look into that. I know you have to hit a certain level. It's not just for new providers and stuff like that. So sometimes this gives the team some motivation to move it and do some cases. So talk to your territory manager, see how that works. Because if someone can't afford that lab fee, this might be a way to reduce it or eliminate it. And it gets the whole office jazzed up to get it done. Now, keep in mind, I don't think you can have more than one going at a time. They have all kind of rules. I don't know what Align Technology's policy on this is. So you're going to have to ask them. And I think it changes. So you need to make sure they know who's getting it and who they're working it for, and then who the next person is, in line to get it and when they can get it and what KPIs they have to make in order to get this. So this really just gets your team to work for you, spotting other starts from other patients, hygiene patients, things like that. If they want this for free or almost for free, this is how they do it. But I would definitely have the fine print written in writing, at least, so they realize that if they quit or if they are fired, or if they move, they're responsible for finding a new provider, and that you will transfer the case to them, including the additional aligners and everything like that. I always recommend doing all your cases as unlimited. That way there's a lot of wiggle room for this happens. Okay, so that takes care of full-time employees. Part-time employees, you can give a discount. Obviously they pay lab fee and they pay an additional fee, maybe they're paying 50%, and same thing for the life of the case. Staff and spouses and staff's kids, that's going to be your normal friends and family discount. So, 20% or whatever you're going to do. I mean, it's going to be a discount, but it's not going to be anything massive. They don't like it, they can go someplace else. I mean, it's probably going to be cheaper than whoever's next door, and they might have insurance. So just have a set situation, and you can also, this is the friends and family rate is a great way to get And you can set this up any way you want. I mean, there's probably people out there who have better ideas than this, but this is just basically how we do it, and it just keeps things simple. All right, thanks so much. And then I was going to mention we do also do white label aligners for super simple cases for staff, and they pay per aligner, and that actually really decreases the cost as well. If you're interested in hearing about that, shoot me an email. Thanks.